Hi everyone, welcome back to the live session, and in this video we are going to consider a clinical situations where we find pediatric patients of usually around 4 to 6 or 7 years of age with occlusal caries. And in such scenarios, if we find out any symptoms from the patient, there are no symptoms. When we see clinically, there are occlusal caries that we see on the primary molars, and we usually have no symptoms. So what could be the best approach? That is the ongoing poll, and this is the theme of today's live session. What should we doing when we are not taking the radiograph, as there are no signs or symptoms except that clinically there is an occlusal caries. So beginning step by step, our first approach always should be to remove the caries that is in every aspect, whether we need a pediatric endodontics or any situation. We should be able to get this tooth in disease free from the current situation, and thereafter progress step by step. So first thing, hope my voice is audible to you. So first thing is that we should be removing this carious lesion with a round diamond point. So let us proceed step by step. So we are following a method of excavate and evaluate when we don't have a radiograph. So, and there are no clinical signs or symptoms except the clinical appearance of caries. So we are removing this caries slowly, step by step. So when we have an occlusal pit caries, this caries goes deeply and spread as the dentine progresses. So over here we are able to remove the caries in this primary molar. This is tooth number 5. So you can appreciate that the caries has been removed. Now let us progress to the tooth number 5. See, try to conserve the maximum tooth structure that is there, the sound tooth structure. There is an ongoing poll as to what should be the best approach when there are no clinical, no signs and symptoms. So over here in the tooth number 5 also, we are able to remove the carious lesion. And underneath you can observe that there is a shadow of the pulp So this is the roof of the pulp chamber. There is a darker area over here. So we need to restore it wisely. So we are opting for a bioactive restorative, and for that we have the pulp dent Activa Kids bioactive restorative. So we are using a bioactive restorative. This is an Activa Kids bioactive restorative from pulp dent. This bioactive restoration is working continuously inside the patient's mouth, that the restorative is trying to remineralize the tooth structure that has already been demineralized. So the steps involved over here is, once we have removed all the caries, we have dried the tooth. Now the step involves is we are using the bonding agent. This is the 7th generation bonding agent, Fusion Bond 7 from Prevest. So we are using this one as we don't require an etchant, and this is a light curing self etching bonding adhesive. Hope my voice is audible to you. Now my second question to you is, when we are applying any type of bonding agent, do we need to switch off the light or we need to divert the chairside light? This is an important aspect when you are applying this bonding agent. What could be the best considerations? Hope you are able to appreciate the shadow of the pulp tissue beneath both these molars. So now we are applying the bonding agent, the 7th generation, so we don't require an etchant. You have to scrub off the entire surface. Once applied, then use your 3-way air, first slowly for few seconds to let it spread uniformly, then fast. Let it spread uniformly inside the cavity, and this is the time you may need to light cure it. Light cure it for 30 to 40 seconds as per the manufacturer's instructions. We are using a 3M LEPAR light cure. This has a good intensity and depth of cure is really good. So once done, you can check your bonding agent. And this is the time you may use your Activa Kids bioactive restorative. So this Activa Kids bioactive comes with an auto mix tip. This is an auto mix tip, as you can see over here, and this is also a dual cure. So basically first 20 seconds it would self cure, and then we would need a light, the curing light, to cure it. And we use the Activa dispenser to dispense it. And when we are doing or putting it into the cavity, do not remove the tip, just let it flow and see the shade. It is a pedo shade. Just don't overfill. And let it set. So let it set into the cavity. Occupy those occlusal anatomy, and this is the time you are not using any instrument, and this is the time you need to light cure it. So now we are going to light cure it after 20 seconds. And light cure it for around 30 to 40 seconds. So once done, this is how your restorative looks like in the light when it is completely set. See how glossy appearance is, and it has established its counters along the tooth. There are no elevated margins. It is smoothly occupying all the area, and in the tooth number 5-4 we can hardly differentiate between the tooth and itself. So this is the advantage. Now this restorative, the ActivaKids Bioactive, would be working inside the tooth and would not allow any demineralization aspect of or the bacterial infiltration, and it would enhance remineralizing. It has a remineralizing potential. So this is the basic advantage of this ActivaKids Bioactive Restorative. So hope you were able to understand the concept of using this type of restorative. A good pedo shade we have, and the good restorative ability, and the additional feature of bioactivity. If you have any queries, you can ask in the comment section below this video. We also have the ongoing membership program where we teach individually in the one-to-one mentorship program. So if you want to learn anything more specifically, personally, you can join our channel membership. Thanks for watching. Bye bye.